better.
Oh yeah.
What is that? Instagram? Is
Instagram.
YouTube? Is it YouTube Live?
Instagram is too.
Oh, Instagram goes 16 by 9. But isn't that like, yeah, man? Hmm. Does this thing work?
Oh.
There's a prop.
No, we need to get this mic. It's like $300.
Okay, boom mic.
All right. Welcome, everybody, here to News Talk
Let's
790
do it.
WNIS. I'm Damian Hall. Happy to be here with you once again on this Ask the Expert show to talk with you and Dr. Adam Hogan about the life changing impact of dental implants, stepping out of the dentures, throwing those to the side. If you have missing teeth, unsightly teeth, ill fated teeth, well, we have a solution for you. It's right here in our own backyards. It's Dr. Adam Hogan, a family owned, family operated practice in Virginia Beach called Full Implant Choice. You may have heard of it, and we'd love to hear from you this hour. If you have a question or something that's on your mind, we have open phone lines, of course, like always, but we've got Dr. Adam Hogan here live on the show and as well as live on YouTube and Instagram right now too, so you can actually view as you listen if you're not driving at least. But Dr. Hogan, how are you? How are you feeling?
I'm feeling pretty good, Damien. Long time no see. I feeling pretty good. Looking forward to this Thanksgiving week. How about you?
Yeah, yeah, feeling good, feeling thankful. Thankful that there's more summer. Sunshine. I don't like it being dark this late. I don't like working the night gig when it's a night show at 6 o'clock. But that's I guess my one bah humbug for the season, and that'll be it. But
Yeah, everybody in your cars. It's 6 o'clock. The sun goes down early, so slow down. It's not a race to get home. Please be safe. We understand, and hopefully this country figures it out next year and doesn't set these clocks back again. What do you say, Damien?
yeah, I'm so over
Yeah.
changing the
It,
clocks. We'd all get used to it, and it wouldn't be a thing if you just
yeah.
got used to the time just being the time.
Where's the petition? I want to sign.
Yeah, yeah. I'll sign today. You get a lot of names on that petition. And same thing with full implant choice in Virginia Beach. If there was a petition for people to ditch the dentures once and for all and step directly into dental implants, I bet you could get a couple thousand people at this point on the list on the petition to tell
Yeah.
people that they don't have to suffer through missing teeth or unsightly teeth, and that there's a solution here in Virginia Beach for them. Tell us a little bit about full implant choice.
Yeah, man, I'd love to tell you about that. It's funny, I was going to go in the same segue. Like this November, it's getting dark early. Let's all sign the petition to ditch this whatever it was where the clock set back early, and let's all sign something to move on and improve our lives with a brand new smile, get rid of those bad teeth. So that's what we do at Full Implant Choice. We help people um, we help people that need teeth. They want to get rid of their dentures. They want to ditch their dentures, their partial dentures, or they don't like their teeth at all. And we really help you. I say this all the time. It's not just about teeth, Damien. It's about having a new and better life. And this hour, I'd love to show you. I'd love to tell you why and how.
No, awesome, awesome, great topics. The new you, the new life that's ahead of you, just a stone's throw away on the calendar. We're talking about 2026, and Dr. Hogan can get you on the schedule. I'll give out the phone number throughout the whole show, so write it down: 757-629-4259.
That's correct.
4259. Again, 629 4259. And we'd love to hear from you live here on WNIS AM 790 as well if you're listening live on the air. But it looks like you have a guest with you there right now.
Yeah, we do. It's oh my God, it's such a great day, Monday. So much to be thankful for this
So much.
week with Thanksgiving
Yeah.
coming up. I guess we just timestamped the show, so
Mhm.
not out there for a future pre-record. But
Hang on. I heard you say the whole thing about it getting dark.
yes,
Can we sign a petition to stop daylight savings
that's what
time?
we were
Okay, is
saying.
that what I want to? Okay.
So we got 3 people. So with three, you, me,
Three.
you, me,
Who
and
else wants
Priya.
to join?
Yeah,
It gets too dark too soon. I don't like it.
it does. So everybody out there listening in Radio Land, if you can't see us, we've got Bria. I can't tell you her last name because then you'll try to steal her away from us. But she's my friend, and she's answering our phones here along with a couple of other ladies.
Yes, we've
Maybe
got
3 other.
Talia
Yeah.
on.
Talia's on right now
Yes.
on the phones 429
629
629. See, this is why I don't answer the phones.
This is why you're not in charge.
629 4259.
We
So
just leave you to surgery.
we had a good one today.
We did.
We had a good one today. Upper, lower, all the set of teeth, just a few hours. Bam, out the door.
Yeah.
And he was a grandpa. Yeah, he brought his kid. Did you see his grandkids
Yeah.
in here?
I just want to have new teeth for the holidays.
And he's gonna have new teeth. He's got new teeth today.
Yeah.
Yeah, he's got new teeth for this weekend. So if you can't see us, we're also on YouTube and Instagram or listening on WNIS. But yeah, Damien, we convinced Bria to come out of the phone closet
I came out.
and come online.
But I got Talia, so if I miss their call, then I've got Talia to answer their calls.
Talia's in there.
Yeah.
So what do we have to be thankful of for this today? What was so much?
Friends,
Friends,
family,
health,
the ability to eat.
I'll take it,
So
and the ability to
the
smile,
ability to smile.
right?
But we want to give back.
Oh yeah. You
Yeah.
came on here for a good reason.
I did.
Tell them about giving back.
So, in the spirit of Thanksgiving and being thankful, we would like to give back. If this is something that you've been thinking about or you're hesitant about, now's the time because we're going to be running a special and the prices, the discount price will be discussed in your consultation. So, just give us a call. If you're on the fence or if you've been wondering what we're about, now's the time to come in and meet with me or one of our other lifestyle coordinators, and let's get you in here before the holidays and get you a new smile.
So you just came on the air to give away
More
our
money.
money. Yeah.
Facts.
Actually, to be serious, we try to do this every year around Christmas time. We've been blessed with another good year. We met. You talk about being blessed with friends and family, and do we or do we not believe that new patients are friends?
They are.
Fact, right?
They're
They're
facts.
absolutely friends.
New patients are friends that become family.
I mean, in many ways they do.
Yeah.
Yeah. I mean, we've developed close, intimate relationships with everybody. But so we've had another good year, and Damien, we're prepared to give a little bit back. So it's tough to give an exact discount over the airwaves because Damien, you've got like millions of people listening at WNIS. There's millions more that could potentially listen on social media from around the world, and we don't know what you need.
Yeah.
So you can't be like, well, on the radio, it's X amount of dollars, right? It really depends on what you need, but
Well, it's the
we're
same
feeling
reason
generous.
We don't give an exact treatment plan over the phone either.
Let's-
We have to see you. It has to be everything that we do is personalized. It's
Yeah.
tailored to each patient. It's tailored to each client. So I can't really give a flat discount if I don't even know what they need yet.
Can I talk on that for a second as a
Yes.
doctor? As when you call, when people, not you, Bria, but people listening, when you're people watching YouTube or watching Instagram or listening to AM790 WNS, when you call an office and you say, how much is it going to be for XYZ? You're going to get one of two things. You're going to get somebody that gives you a low ball price just to lie to you and get you in the door. So we call them skis balls or liars. Okay. Because they're just being dishonest with you.
Okay.
Because they just want you to hear a low price and come in the door. Or we think it's a disservice because they don't really know what you need.
I like that phrase better. Can we go with that one?
Well, yeah, okay. We'll just assume that they're not skis balls.
Yeah.
Okay, so no skis balls out there.
Correct.
Skis ball is a game you play at the fair, at the carnival.
Close.
Is that right?
Yeah. It's
That's the one with the ball?
It's skee ball, but yeah.
I'll call it skis balls.
You're close. You're close.
Okay, we'll call it I'm calling it skis balls.
Okay.
All right. So maybe there are no skis balls out there, but there are. And they're not really doing you a service because they don't know what you need. So
Okay.
it's misleading. At the very least, it's misleading.
It is misleading.
Right?
And if you can just give me 45 minutes to an hour of your time, then we can have a completely tailored plan for you personally and go over all your options and what discounts I'm able to give you before the end of the year.
And I want to say something else.
Okay.
To everybody out there watching Instagram, YouTube, and listening on AM790 WNS, why would you just think the most important thing or the only important thing is price? You know, you're
Because
going
we're all struggling right now.
well, okay, but maybe people are, but you're gonna have a doctor and their team put their hands in your mouth and do something for you. Don't you want to meet them?
Yes.
Is price the only thing?
No.
Right. And let me tell you something else about people that give prices over the phone. I just met with a gentleman. You were in there. I don't want to say who.
Mhm.
Don't say his name. We don't know how he might not want to be out here. But he had a phone consultation with a corporate chain up in Richmond and DC.
Correct.
Right. And they gave him a price. I asked him a question. Bria, you were in the room. Did he talk to a doctor? He got a price on the phone. Did he talk to a doctor?
No.
No. When these people call these corporate chains out of state, Bria, you answer. Have we ever heard that they talk to a doctor?
No.
No.
And
So
they can't have an X-ray.
they have no x-rays.
Yeah.
So they're calling somebody in the office
Mhm.
and they're talking to basically just an employee who's not a doctor.
I'm not a doctor.
No, but I'm not talking about you. I'm talking about
I'm just saying, if they called me, I'm not a doctor. Same thing.
that's what you tell them.
I can't give you an accurate treatment without seeing you and taking an X-ray.
So this gentleman got a price
Mhm.
up in DC from somebody who's not a doctor. And after no doctor reviewed even the x-ray that she sent on her little piece of paper.
Mhm.
Nobody. So they got a price. And did I agree with their treatment plan?
No.
No. Why?
Because it's not in the best interest of the patient.
No. Because they were quoting him half the price because he called about his top teeth
Mhm.
and he got a general price. He needs his bottom teeth treated too.
Correct.
And nobody told him that.
They don't know.
They wouldn't know. No
They
doctor
took the
looked.
patient's word for a self-diagnosis.
Yeah, nobody knew. So this is what we're telling Damien, everybody out there listening and everybody watching on YouTube and Instagram is you can't get an accurate diagnosis without coming in and seeing a doctor. Then therefore you can't get an accurate price. It's ridiculous. It's like calling up the heart surgeon and being like, hey, another doctor in Utah says I need triple bypass surgery. What's your fee? And
Yeah.
right?
Yeah.
I think it's absolutely absurd. I don't know.
You wouldn't go into surgery for any other part of your body, so why would you for your teeth without a consultation with your doctor?
Yeah, things that I want to buy that I don't care who's selling it. Things I want to buy that I really don't care who's selling it. A car, a boat, a couch.
Mhm.
Things I don't want to buy from people that I don't know or don't like. Eyeballs,
Kidney.
faces, kidneys, breast implants, teeth. I mean, you see the track
Yeah.
record?
Makes sense.
You might want to meet your doctor.
And we're here and we're available. You just have to call me.
Wait, you're available? I thought you were seeing somebody. Yeah, so that's not entirely, I can't trust her. I'm not available either, but I am. I mean, for doctor stuff,
We're available
for patients.
to make an appointment.
Yeah, exactly.
757-629-4259. Me and Talia want your calls. Call me.
For the record, not married, but
Technically married.
work wife, very good friend of my wife,
Yeah.
and my good friend.
Thank you.
Yeah, thanks for joining us.
Thankful for you and thankful to be a part of Full Implant Choice.
Thanks for coming on here and giving away all of our money until December 31st. You didn't say they have to sign up before the end of the year.
Sorry, guys.
Right?
You caught me. I tried.
Right. Got to
Bye,
sign up.
Damien.
Thanks, Bria. Awesome. Great to see some
Dude.
smiling faces. You do have a great staff there. You've brought in a number of them. I've met a number of them when I've had my teeth done too. But tell us a little bit about your staff because you got a unique business all the way around for being here in Hampton Roads, let alone just tell me about it.
Yeah, I mean, Bria right there, like that's like the example of everybody you see. Everybody's happy and dedicated and wants to be here. It's a place where I mean, we really find meaning in our job, in what we do, in bringing happiness to people. And everybody here is compassionate. Everybody here loves people. Everybody here wants to see people get the best interest. So, there are jobs you just go to and you clock in and you get some hourly pay, and then there are career paths that people make and decisions that they make because they like going there. And I think that we're blessed to have a full range of people that love coming to this office and love working. And Damien, I mean, you can comment on it. You've been here, and you know what it's like when you come in the building.
Mm-hmm.
Yeah, good.
Yeah.
Yeah,
No, friendly faces everywhere you see. You know, people know your name. It's like the Cheers theme song. It's like you walk in the door. It's like dum da 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 dum dum, and everybody's friendly. Really cool because when I got my teeth done, I have two Dr. Hogan implants with full implant choice in Virginia Beach, and getting them done, the staff is so friendly. And I remember specifically people cheering a couple seats over and like cheering like it was somebody's birthday and we were at a restaurant or something. I was like, what's going on over there, what's happening? And just everybody had to go over there, all of the staff, and congratulate this person, and everybody's smiling and laughing and having is just so happy of somebody's situation. And come to
yeah,
find out, it was just somebody got their final teeth and they were just so happy, and the whole staff. Yeah, it was just pretty cool. It's definitely a tight knit group and a family feel. It's
yeah,
unlike any feeling that anybody listening will ever get at a traditional dentist office by far, by far.
yeah, yeah. We had like I said today, we had a gentleman, grandfather, met grandkids, beautiful grandkids. But today, brand new set of teeth, and everybody that met him, Bria and Megan in the office that met him when he came in for a consultation, everybody that worked on him, just taking scans in the back before his surgery procedural day, and the surgical techs and assistants that were working on this morning, everybody came in to see him get his new smile, his new teeth, and it's a genuine experience. Everybody wants to be there, so it's really what we live for, and we strive to do every day. And we've got another one tomorrow. We do this every day. I think that needs to be said. This is all we do right here is brand new teeth, brand new smiles.
No, I love that. And that is important to know. It's only working on creating those beautiful smiles for people listening. There's not, cleanings and cavities going on. It's focused directly on dental implants. And everybody listening can get a consultation. All you got to do is pick up the phone and call 757-629-4259. That's 629-4259. Or you can go online to fullimplantchoice.com. Fullimplantchoice.com. Get a consultation scheduled. Tell them you heard this WNIS show, and they'll take good care of you too. Well, I mean, you'll get that great treatment anyway, but just make sure you tell them you're a WNIS listener when you do. As well as right now, live on YouTube and Instagram. You can call Dr. Adam Hogan's office again, one more time, 757-629-4259. And if you have a question, feel free to join us here on tonight's show. But Dr. Hogan, leading into us being here in Thanksgiving week, leading into the extended weekend and into the holidays, it really is the beginning of the family-oriented holidays,
Yeah.
being Thanksgiving and Christmas, Hanukkah, Kwanzaa, right around the corner. But tell me about it, because when we're talking about thanks in gifting, I know that teeth are something family members gift to other family members often. In what scenarios do you see that playing itself out, where people, take care of their loved ones and hook them up with a beautiful smile?
Yeah, I'm still hooked on Chris Kahana Kwanzaa. What?
Chris
How do you?
Chris Mahana Kwanzaa.
Chris Mahana Kwanzaa?
Yeah,
Okay.
it was on
I'm gonna.
a commercial many years ago with a Happy Chris Mahana Kwanzaa.
Okay, all right. I'm gonna have
Yes.
to ask Rock. I don't know. Um, I'll spell that later. Yeah, I mean, gifting smiles. Look, the holidays are coming. Let's talk about it. The holidays are coming. And you don't have to wait for a holiday to give something away and help somebody out. I mean, we've got all year round, we've got relatives helping relatives and friends helping friends, family helping family. And, it goes around that sometimes, there are people that need and there are people that have and there are people that don't have. And um, everybody out there listening, I guarantee that everybody out there in your car, in your home, in your garage, at your workplace listening right now, if you don't need a brand new smile, you know somebody that does. You know somebody that does. So if you need a brand new smile, full implant choice, we're the place to do it. If you have a friend or a family member that is feeling self conscious about their smile, their teeth don't look so good, They can't eat. They don't go out. These people probably need to talk to us, and you can simply pass the message. Hey, have you heard of Full Implant Choice in Virginia Beach? It's a family-owned, operated place. This is all they do is give people brand new smiles. They're, they're experts at it. They know what they're doing. And in fact, Dr. Hogan teaches it around the world. And you could help your friend, your family member. You could say, go there, go to Full Implant Choice, get a new smile, feel better about yourself. And then, there are people that have, and they can help out. And we see all the time parents helping their older children. We see children helping their parents, brothers and sisters helping each other, helping them to afford it. Even if it's just a cosign on a loan, or maybe it's financial help, that's up to you. That's what you do at your kitchen table. You decide who you want to help. But you can help people to feel good about themselves, and you really give people a brand new life. I see people, and I can make no guarantees, but I'm not making any false claims, but I see people that are depressed get new teeth, and they're off their antidepressants and living life again. No guarantees for everybody. Again, I didn't say that, but I see it often. Last 2 weeks ago, we just had a woman that I've seen her for years, clinically depressed, and struggling with a denture that's removable. And she finally took the plunge and she got brand new teeth. And man, her hair is done, her face is done, her makeup's done, her nails are done. She's wearing new clothes, and she comes in kissing and hugging on me and everybody, happy from ear to ear. And she's out living her life. And what's she doing? She's going out to lunch. She's going out to dinner. She's out with the girls. It's like happiness. And it's Christmas season, and you can give people happiness, and you can help your friends and family members find happiness at Full Implant Choice. It's really way more than just a set of teeth. It's way more than just a set of teeth. It's way more than a tooth. You talk to people without teeth. I talked to a lady on the phone up in Surrey today on FaceTime, and I noticed, and she said she had anxiety and depression, and um, I said, you haven't, I just noticed, you haven't smiled at me once this whole time. And, she said, of course, it's because I don't have teeth. And I said, well, do you think having teeth would make you feel better about yourself? She said, absolutely. And if you're one of those people out there listening and you have all your teeth, you don't even know. But imagine getting in your car and going to work today missing your teeth. Imagine how different your day would be. And I don't have to tell people that are missing their teeth. You already know what this is like. Trying to function in today's society, having missing teeth. It's terrible. In the United States of America, it's terrible. It's hard to live with, it's hard to get by. And we understand that. And there's no shame in that. This is the place you go to get it all fixed. I see you, Mike. We're got to go to a break, but we can pick up on this afterwards.
Yeah, yeah, absolutely. We'll be here till the end of the hour, and everybody listening can call and get a consultation scheduled now. Don't wait. Don't wait until the end of the year. Call now. Tell them that you heard the WNIS show and get special treatment. Call 757-629-4259. That's 629-4259. Or you can go online where you can see pictures, videos, some testimonials of people looking at and feeling their beautiful smiles and fresh new teeth for the first time. Some great pictures and videos there online at Full Implant Choice on Instagram, on Facebook, on YouTube, TikTok, I believe, all of the socials, as well as the website, Full Implant Choice in Virginia Beach. And we are here this hour to take your calls and questions. If you have any, we'd love to hear from you. 627-7979. I'm Damian Hall. We're here with Dr. Adam Hogan from Full Implant Choice, and we'll be right back right after the short break here on News Talk 790 WNIS.
All right, everybody. If you're still, hey, Mike, can you cut that commercial, buddy? Cut the sound on this side.
He doesn't have his headphones on.
Yeah,
I'm going to tell him to
Mike, can you cut that commercial, please, buddy? Can you
cut
cut
the
that
audio.
commercial sound on my end, please? Thanks, bud. All
Cool.
right.
You're good.
6 minutes. Hey, Bria, do you have any models I can talk with? Do you have any models? The radio's on a commercial break. You got that? No, bring me good looking stuff. Or bring me stuff with implants. Yeah. Thank you. All right, guys. If you're still on here, YouTube and Instagram, we're on a commercial break at AM790 WNIS. I just sent for a couple of models. But I got to tell you, we have the best day. We had the best day today, like we always do around here. I want to take you through maybe our typical day for a second. Um, morning times. Oh, thank you. Morning times. We have at 7 a.m. We usually start surgery every day, a procedure to help somebody get a brand new smile. And they come in and they're sedated. Thank you so much. They come in and they're sedated. Anesthesiologist is here. A medical doctor is here to help with your safety. And I pay top dollar for that because I want you to have the safest, best experience you can. I think that it goes. It needs to be said that some places they don't tell you this when you call for the price. They don't really tell you. You don't really know this until you go in for the procedure. But some people just numb you up. Some people give you a tablet to take just to kind of take the chill out. That never really works. Some doctors do IV sedation, and in my opinion, it's not the best form of sedation. I don't think it's very safe. It's very hard to manage the ups and downs of IV sedation and manage patients. And when I'm trying to worry about doing a perfect complex procedure, having to worry about somebody going up in and out, I think that's a lot. But in our office, we do general deep sedation with anesthesiologist. And again, it's a board certified anesthesiologist, a medical grade doctor, and we pay full top dollar for that. And but we just, it's don't worry about it. It's all covered. So when you're calling around, by the way, Bria and I were asking about pricing earlier, and you call and say how much for. People blurt out a number. They blurt out a number, 10,000, 50,000, 40,000, 10,000, whatever, 20,000. It's irrelevant. You don't know what's included. You don't know who's doing the procedure. You don't know who your doctor is. Imagine like you're just calling around like, how much for a facelift? Like you don't even know the doctor doing it. Has he done one facelift, 100 facelifts, 1,000 facelifts? And what do they look like? Is their work online? At Full Implant Choice, our work is online. When you come into our consult room in our photographs, that's our work. And I'm going to be totally transparent with you in the industry. A lot of people have websites with smiles on their websites and their stock photography or their other people's work. I've got a friend in Canada and he's trying to reach out to an office in Northern Virginia for the past 7 or 8 years because this office in Northern Virginia is publishing my friend's work from Toronto on their website. It's not even their work. At Full Implant Choice, it's all our work. So, you and your family and friends are calling around offices and you go, how much for a new set of teeth? First of all, unfair question. Nobody knows exactly what you need. Nobody knows what you need to have done. And they can't really give you an accurate price until a doctor sees you and diagnoses you. So you're either going to get lied to or you're going to get misled. It's not a fair question. You should be calling there and saying, who's the doctor there doing the procedure? How long have they been doing this? Can I read their resume, their biography? You should come into the office and you need to observe the office because I've had countless new patients and friends come here and they say, you're my second, third, fourth, fifth consultation. I look around this office. First of all, everybody's happy. Also, everybody knows what they're doing. Everybody's competent. I can tell by looking at them. And they'll tell me left and right, I don't see this at other places I go. And you're calling around offices going, what's the best price? What's the best price? What does their team look like? What does their team act like? 2 minutes? So you say, what does their team look like? What do they act like? What is a doctor? What are their capabilities? Also, what am I getting for my price? That's how we started on this. Our general anesthesia with an anesthesiologist is included. And you go into a lot of other places, you're either not going to get that Or when you get there, they'll say that's an option, but it's extra. All right. So a lot goes into the question, how much is it? Try calling a car dealership. What does that mean? 30 seconds?
Yep.
Try calling a car dealership and just blindly saying to the person on the other end, how much for a car? Well, what kind of car? What do you want? What do you want exactly? Do you want a used car? Do you want a luxury car? Do you want a good reliable car? Do you want a not so reliable car? Do you want a banged up car? So a
All right.
lot goes into that question. How much? I think we're back.
Yep. Yep.
Are you back?
All right, we are back. That's right. We're back here on News Talk 790 WNIS, live on the airwaves at WNIS.com as well. And we're live on the interwebs at YouTube and Instagram, I believe, with Dr. Hogan from Full Implant Choice. FullImplantChoice.com is the website to go to. They're family owned, family operated right here in Hampton Roads. And I'll give out their phone number for consultations to be scheduled by all of our WNIS listeners, as hundreds and hundreds at this point of WNIS listeners have changed their life, heavily impacted their life by the change of a smile, all in one day. From a frown turned upside down and just enjoying that smile to the rest of their days. That's what we're talking about today. And that new you is just a phone call away to Dr. Hogan's office to get that consultation that can, be the start of the new you. But Dr. Hogan, I'm glad to have you back here for this half of the show.
Yeah. Thanks for having me back. That was a long break to talk by myself. I'm glad you're back.
Yeah, no, and I know you're doing a long form on the interwebs. You're doing a lot online right now. I've seen videos, and a lot of it's entertaining. It's pretty good, kind of funny entertainment stuff that you do on the interweb, on Facebook and whatnot, with Full Implant Choice. It seems like you're having fun with it.
Yeah, we're having a good time. You know, we like to be real people here. And so you're talking about Facebook, Instagram, TikTok. And I think that there's a lot that goes into that. We like to put out information, but we know that if we just bore you with information, you won't tune in. So we also like you to see who are great personalities here. We think we have pretty dynamite personalities. So there's that. Also, I've been podcasting now to the dental industry. I don't know if you saw, if you're a doctor out there listening, you might want to follow, or if you're a patient and you want to hear some backroom conversations between doctors, you might want to listen to the All In, All on X podcast. It's called All In, All on X. We just launched that. But I'm having fun with it, man. I've enjoyed talking to you for 6 or so plus or minus years. And I mean, I just think it's fun to talk online and give people the real truth. So some of the things we delve into in the All In All NX podcast, it's not all just teeth. We'd like to talk about life and things that revolve around doctors, their families, their staff, whatever. So it's quite entertaining, and we're having a lot of fun with it.
No, that's great. All in, all on X. And where can people, listen to that? On anywhere you can get your podcasts?
Yeah, there. Evan's got the logo up right now. Yeah, at the podcast app on your smartphone or on
Oh,
Spotify as well. And you'll catch episodes being put up on our YouTube page at All In All on X on YouTube as well. But while we're on YouTube, I want to encourage everyone, all your listeners, to follow Full Implant Choice on YouTube as well, because you'll get to see a lot of you'll get to see a lot of good dentistry and surgery. And let's face it, a lot of patients, a lot of potential patients, they want to see that your doctor and your team are competent and that they know what they're doing. And, we post on their procedural videos, because doctors call me from around the country and the world, in fact, and ask me all the time, hey, how do you do XYZ? Or give me some advice on XYZ. And, that next day or the week, I'll be in the office doing one, and I'll say, get a phone out. Let's record this with the consent, permission of the patient, of course. And I'll say, okay, doctor, there's a procedural video on FullImplantChoice.com, or maybe the Atlantic Implant Institute or somewhere, and you can take a look at it. And if you're curious about Full Implant Choice and our great expert capabilities, go on there and take a look. You'll see some procedural stuff. And I know people love, like, Dr. Pimple Popper and whatever. And I'm finding that people are loving watching us place implants. And truthfully, we don't do it enough. I'm involved in procedures all day, and there's just nobody available to take a recording, or we don't want to slow us down. but that's there. Also, you'll see a ton of patient testimonials. I mean, people talking about what full implant choice is, what their experience was like, what we did for them, what it did for their self-confidence in their life. So anybody listening that wants to get a glimpse into what we're capable of doing for them and for other people and for their friends and family, please go take a look at Full Implant Choice on YouTube, Full Implant Choice on Instagram, Full Implant Choice on Facebook. I promise you, you're not going to be disappointed in what you see. And give us a comment, drop a like, make a comment, contact the office. We'd love to hear from you.
Yeah, no doubt about it. And we have open phone lines here at the radio station. You can feel free to join us there. Well, I'm not going to give out the number because it's everywhere and our listeners already have it. Again, we'll be here until the end of the hour with Dr. Hogan, family owned, family operated. And Dr. Hogan, you were mentioning back there talking about the podcast that you guys like to talk about some of the truth and, lay some light on some of the misconceptions.
Yeah.
What are some of the things that people get tricked on, get fooled upon when it comes to dental implants? Some of the mistakes the listener might make when it comes to making this possibly life changing decision, hopefully to the positive. But
Yeah.
unfortunately, sometimes it becomes a negative for some people's lives when they make the wrong decision.
You're talking about patients, the mistakes that patients make?
Yeah.
Yeah. Yeah, because I mean, that's quite simple. I mean, two things come to mind really fast. Um, One is waiting too long. Number one, waiting too long. Anybody who tell you like my patient this morning, like my patient last week, like the woman that was chronically depressed for a long time, they all say I waited too long. I could have had this 3 years ago, 5 years ago, 10 years ago. Man, my life would have been different. I hear it all the time. My life would have been different. Um, Evan, I think we lost the feed on us, but anyway, um, they always say, "Man, my life would be different if I just did this a little bit sooner." And then, the other thing is people that are shopping just for cost, people that are shopping looking for the cheapest deal. Um, Hang on one second. But yeah, they all tell you like they come in here and they need something redone, and they've been down a road where it didn't go so well. And when that happens, um, when that happens, it's like we've got to redo everything,
Yeah.
And now they waited 5 years to get it done, and then they go with the cheapest bidder, and they don't like what they're doing, and they're with the cheapest bidder, and it's and they realize that they've got to do it all over again. They've got to start over, brand new, once again, brand new. So that's that's probably the two biggest mistakes that people make.
Yeah, no, that makes sense. And I often say buy it nice or buy it twice because if you don't buy it nice and you buy the cheap version and you try to think that you're going to make a play on the market and buy the cheap one because that's going to work out just as well. Well, you're probably going to end up having to buy it again, and you're going to have to buy the quality one after that one doesn't work out for you. So, buy it nice the first time. Some people say buy once, cry once, but there's no crying involved unless they're tears of joy, which actually often happens. And people can witness that themselves seeing the testimonials at fullimplantchoice.com. Tears of joy when people smile and see something they like more than they have in the mirror in a long time. Excuse me.
Yeah,
But a very, very special thing there, Dr. Hogan.
yeah,
So tell
no,
me,
for sure.
what have you seen in the last few weeks there at Full Implant Choice?
Oh man, last few weeks. I mean, I've been seeing I see a little bit of everything every day, which is why it's important to go somewhere where, they can handle a wide variety of issues. I don't know how to get to it here on the air in just a short amount of time, but not everybody needs exactly the same thing. But if when they talk about replacing all the teeth in their mouth, but yet, when you look on the internet, you're made to believe that everybody is exactly the same. Everybody is just like, oh, it's just one procedure for everybody, one price for everybody. And, that couldn't be further from the truth. I've been seeing, for example, a lot of younger people come in lately. I mean, the average age to get your teeth replaced, they'll say typically is about 60 years old. Is what?
It's only on there.
Okay. Is about 60 or 70 years old. But yet, um, I'm seeing a lot of people come in their 30s
Oh yeah.
and early 40s. Yeah. And one of the things about that is that they have a disease of the teeth, but not of the bone. See, a lot of our more mature patients have the bone receding. And so, we've got to replace the teeth and the bone and the gums. But when you have somebody come in that's like 31 or 41 years old, they've got some rotten teeth from, whatever it is. It's sugar, it's alcohol, it's drug use, but they're sober now and they need a better life. And the bone is good. And if you make the mistake of calling around the country and saying, how much for this procedure, and you get this base bottom dollar price, you're going to get your bone cut off, even if it's good. You're going to get your bone cut off. They do everything, the vast majority of these places do everything one way. And they look at a younger person the same way they look at an older person. They look at a person with bone the same way they look at a person without the bone. And so uh, everybody just gets the same hammer, the same nail. The doctor, the office, they have one tool in their toolbox. So, it's very frustrating for me to know that that's going on. And then on the other end of it, there's a lot of people that don't have really any bone at all where the teeth used to go. And the office would tell them, you're not a candidate for implants. Or they'll falsely tell them, yeah, we can do it. And then the patient shows up, because I've seen this happen many times. I've had patients come in here and they say, oh, I called this place in Richmond or DC and they said they do it. We set up a day. When I got there, the doctor said I can't do it, because they don't have the skill set to treat people that are low on bone quality. So I've got to be able to treat people with no bone, treat people with a little bit of bone, and treat people with a lot of bone. And it's probably too much for everybody listening out there online, but you really need to go to an office and a doctor who has multiple tools in their tool bag to fix you, not just one little tool. I mean, if you call a place and they're spitting out some low price, there's a good chance they're either deceiving you or that office has one tool and treats everybody the same. And you've got to be very, very careful of that. And now I'm giving away the secrets of the trade. I know there's doctors out there who aren't going to be happy that I'm saying that, but it's the truth. And people who know me know that I'll give you the truth, no matter what it does to me. I don't care. You send me letters, you send me hate mail, doctors, I don't care. I'm going to give patients the truth. They're going to hear it. Not everybody is the same. And that's why we cannot just give out a price to everybody who calls over the phone, because you're not all the same. And I'm going to say it too. There's a good chance I'm probably going to disagree, potentially going to disagree with the treatment plan and the recommendations you were given. That's another office.
Yeah. Well, that's fair. And everybody listening needs to interview multiple doctors in multiple offices and really educate themselves and go online and do some research. But it really takes sitting there and asking the questions to the person who's going to do the surgery to you and for you. And to that, it's Dr. Adam Hogan with Full Implant Choice, family owned, family operated. And will you touch on that for a minute? What does it mean to be family owned and operated when it comes to dental implants in today's environment? And what makes that different from when somebody might be shopping around and looking for the best place to have their dental implants done?
um, it means everything. What does it mean to be family owned and operated? It means everything. Anybody who's been into a corporate office or a corporate run restaurant versus a family run restaurant knows the difference. And we care. We care because my name is on the building. My name's on the practice. I think that there's a whole higher level of concern for the quality, because I'm not an employee. I'm the founder of the practice. I own the practice, and I'm going to make sure that everything comes out right. I'm going to make sure that everything that I do is built to last. And I'm not saying that you can't get good work at a corporate office. Maybe, yeah. But, I think that we go above and beyond, give you that extra 10 or 20% of compassion and friendship. I know And even if you meet a nice doctor at a corporate run chain, there's a good chance that doctor is not going to be there in 2 years. And, they probably know it too. Subconsciously, they know it in the back of their mind that they're not going to be there in 2 or 4 or 6 years. I'm invested here for over 20 some years. I'm planning on being invested here for 20 more years. And I just know that my dentistry has to last well more than the 2 years, that doctors typically stay in corporate run offices. And so I think you just get I think you get a greater assurance that, or likelihood, I should say, that you're going to get a better level of care.
Yeah, yeah, and having that better level of care is what everybody wants. Do it once and go enjoy the rest of your life. And again, call Dr. Adam Hogan and have that consultation scheduled. Call today. Call 757-629-4259. That's 629-4259. Only about 4 minutes left in this Ask the Expert show. We're live here this evening on News Talk 790 WNIS, as well as live on Instagram and YouTube right now. You can check that out at fullimplantchoice.com or on their associated YouTube, social media account and channels. But Dr. Hogan, we've talked about a lot, and we started off the show talking about being grateful and thankful because this upcoming Thanksgiving, it being Thanksgiving week, Thanksgiving's at the end of the week, and food is a big part of that, a big part of Thanksgiving and in eating foods. And I know that that's a big I don't want to say a selling point, but it's a big celebratory point when somebody gets their dental implants and they can actually enjoy some of the foods for Thanksgiving for the first time in a long time. And I think that goes not really appreciated by people that might not have to suffer through that. And being a time for family and whatnot, I think it's a good time for people to assess loved ones around them and their needs and see if somebody needs a little extra care this Thanksgiving. But I don't know. I should have had a better segued question for you there. We can still talk about so much between
Yeah.
Thanksgiving, family, eating of the food.
Yeah.
Yeah.
Yeah. I mean, it's happiness, right? It's just you're sitting around your Thanksgiving table, and it's not just that you can eat some food, and that's a huge part of it, right? I mean, there's a lot of people out there that come to see us that are looking to survive. They're like, look, I'm down in my weight. Nobody can do anything for me. I need to eat. But it's the experience. It's, you're sitting around and you're eating and talking and smiling and laughing, and you're not worried about what you can and can't put in your mouth because you might chew on it too long, you can't swallow it, you might choke. There's so much more that goes into that experience of socializing while you're eating, so much more of it than just eating alone. And of course, our teeth are going to work. You're going to be able to eat. You're going to be able to chew. You're going to be able to swallow your food and not have to swallow it whole. And that, it's just, but the enjoyment of being out there and not having to think about your teeth while you're trying to interact with other people. And we're leaving here in just a second. Bria popped in. She got something to say.
So I overheard you.
What?
I just got off the phone with a patient
Yeah.
who said he hasn't had surgery yet. He's scheduled for December.
Okay.
And he said his wife said that she hasn't seen him smile this much in years, and he hasn't even had surgery yet
See?
because he feels like he has hope again.
What does that do? What does that tell you?
Nice.
What is
That's
it?
cool.
So
Pretty-
I heard you talking. I had to share.
No, that's awesome. I mean, the psyche, what it does for your mind to know that
Yeah.
you're going to be feeling better. It's overwhelming, really, isn't it? I mean,
It is.
it's just like,
He also said he'll do the radio show because he's so excited to share his story after he gets to you.
cool. Yeah, I can't wait. I'm going to do this more often, Damien. We had a friend, a patient on last month, and we're going to try to get more patients coming on in the future.
Awesome.
Thank you. Yeah. Thank you for sharing.
You're welcome.
Yeah.
Yeah. No, that's that's pretty cool. And again, everybody listening, we're running out of time. I've got less than 30 seconds left. Dr. Hogan, thank you so much for being here on this Ask the Expert show with us this hour.
Yeah. Thanks for having me. I want to say happy Thanksgiving to everybody. Please take some time off, be with your families. Give us a call. Bria's giving away my money until December 31st, so hurry up and get scheduled.
Yeah, get scheduled now. 757-629-4259 for Full Implant Choice in Virginia Beach. I'm Damian Hall with WNIS. Good night.
Good night, everybody.